Viewers, welcome back to Nursing Simplified. In today's class, we are going to discuss about abruptio placenta. As a part of antepartum haemorrhage, we have two conditions. Already we have discussed about placenta previa, and this condition is abruptio placenta. Placenta previa is the placenta getting implanted in the lower uterine segment, whereas abruptio placenta is premature separation of the placenta before the delivery of the baby. So, this is a high risk condition which leads to many complications. So, when we come to the incidence, out of 250 deliveries, one case is reported as abruptio placenta. So, when we come to the etiological factors, again we have the risk factors of multigravida mothers. Multigravida mothers, usually their uterus has become weak already. So, sometimes when there is an inadequate perfusion, it may lead to abruptio placenta. And considering the age of the women who are above 35 years are at risk of having abruptio placenta. And regarding the low socio-economic status, their nourishment is inadequate, so that the placental perfusion is also insufficient, which may cause abruptio placenta. Then we have smoking. Smoking again causes decreased perfusion to the placenta, so again leading to the condition. Then we have preeclampsia. So, when we come to preeclampsia, you know, again there is an inadequate perfusion to the placenta, so it causes abruptio. And then trauma, when there is a decreased blood flow to the uterus. Then sudden uterine decompression. So, it is nothing but when there is an accident or an injury, or sometimes when there is an amniotic fluid rupture, it may also lead to abruptio placenta. Then we have supine hypotension. You know, when there is a hypotension with the change of position, you term it as supine hypotension. So, in this condition also there may be a risk of abruptio placenta. Then we have folic acid deficiencies. When there is folic acid deficiency, it causes inadequate perfusion to the placenta as well as for the baby. So, what happens? Naturally, it gets separated early before the delivery of the baby. Then we have torsion. When you consider the torsion of the uterus, there is inadequate venous pressure to the uterus, which is also causing abruptio placenta. So, with that we finish the etiological factors. Then we come to the varieties of abruptio placenta. Here we have 4 varieties of abruptio placenta, where the first one is retroplacental abruptio placenta. That is retroplacental, that is the the separation begins from behind, and you get that blood clot getting accumulated behind the placenta. That is your retroplacental abruptio placenta. Then we have the revealed type of abruptio placenta. So, in revealed type of abruptio placenta, when the placenta is getting separated, you are able to feel that the woman's placenta is getting separated as bleeding occurs. So, that is revealed type of abruptio. And then we have the concealed type of abruptio placenta, in which there is bleeding happening, but the woman is not able to see by her eyes. It is concealed, where it is going and getting accumulated behind the placenta as blood clots, and we are unable to find out whether the woman is bleeding or not. So, it happens as an internal hemorrhage, which is more dangerous for the mother. And then we have the mixed type, where you cannot correlate with the revealed and the concealed type, because some amount of the blood may be collected as a blood clot and some amount of blood may be tracked out. So, you may have a confusion, maybe only this much she is bleeding. But what happens? This is the most problematic condition, where there is internal hemorrhage as well as externally you are able to see that the woman is bleeding. So, we have 4 varieties of bleeding: retroplacental, revealed, concealed and mixed, where mixed becomes more complicated. When we come to the grades of abruptio placenta, we have 4 grades: 1, 2, 3 and 4. So when we come to the first grade, so usually this first grade you can just see it is correlating with the retroplacental type of abruptio placenta, where the women may have bleeding, but you cannot see the bleeding and it may be very minimal, so that you may diagnose this condition only after the delivery of the baby when you do a placental examination. So this is the safe first grade, your abruptio placenta. And then we have the second grade, where the bleeding, here the bleeding may be present or may not be present, and sometimes there may be tenderness, but most of the cases when you have grade 2 type of abruptio placenta, many mothers, they don't complain of tenderness of the abdomen. And then usually when you check the fetal heart sounds, it is going to be good, because the fetus is going to be safe, where it is going to be a very minimal injury or very minimal damage to the fetus and the mother. But when we come to the third grade, so what happens? It is going to be little more severe, where there may be or may not be bleeding. That is like according to the type, that is maybe if it is a concealed type, they may not be bleeding, and if it is a revealed type, there may be bleeding. Okay, so bleeding will be or will not be there. Tenderness, the women will complain of tenderness, but it is not that much prominent. She may complain there is tenderness of the abdomen. And then shock, when you come, the woman has not cross that extreme limit, so she may not have shock, she will be normal, just she is crossing her limit, so she may not exhibit shock. And then fetal distress, sometimes fetal distress or fetal death may happen, but it is not not compulsory that grade 3 abruptio placenta results with fetal death or distress. But when we come to this fourth grade, what happens? So exactly, typically it is abruptio placenta where the total abruption has taken place. So now you can imagine the bleeding, again it may or may not be present. So that is like your type of abruptio you can categorize. And then tenderness, definitely it is present and it is more predominant. The mother may not allow you to do an abdominal palpation. Then shock, definitely there is going to be shock, because if the bleeding is internal or external, definitely she would have been gone to hypovolemic shock. And then coming to the fetal death, definitely this is the end of the abruptio placenta, where the baby will go in for a death unless and until you identify and treat the condition immediately. So that is with the varieties or the grades of abruptio placenta. So when we come to the management part, okay, so management part, first one is like sedation. So I already said you, the mother is going to have pain and tenderness. See, now I will tell you how you will identify whether it is abruptio placenta or placenta previa. See, there we saw in placenta previa there is no pain for the mother, but here the mother will complain of tenderness, where you can identify it is abruptio placenta. So when the mother is complaining of pain, definitely you have to go for sedation, where your drug of choice is morphine. So 15 grams IM you have to administer the mother. And then you have to go in for blood collection samples, like because you're going to rule out like with that you can identify your CBC levels, will show you what is the HB level of the mother. So with that you can identify whether you need a blood transfusion or just a fluid or whatever it is a need, you have to immediately treat the mother. And then we have shock management. So in case if the mother is bleeding, definitely there is going to be shock. So not even exactly shock, the before stage also you can land up. So at that time you have to start with IV fluids. Next process is the artificial rupture of membrane. So why this artificial rupturing of membrane to be done? So now the placenta is already getting separated and we are supposed to conduct delivery for the mother, and we have to finish the labor process. So now we have to fasten up the labor process. So for that you have to do an artificial rupture of membrane, followed by that you have to start with an oxytocin, like oxytocin drip, like in case if the mother is not having any contraindication, so or the labor will progress. So in case if you are going to delay the labor progress, the fetal may go in for a distress and intrauterine death can happen. So you try to conduct the labor fast and finish the labor process. And then we have vaginal delivery, so that is the last choice. So that is like, to if you want to save the baby, you have to go in for conducting a normal vaginal delivery. Okay, so with that we finish the abruptio placenta, and now we will discuss about the complications. So maternal complications, when we come to maternal complications, we have shock. So already we said the mother may have a concealed type of bleeding or otherwise a revealed type of bleeding. See, when the mother's bleeding is going to be revealed, you know this much is the amount of bleeding and you can give care accordingly. But in case of a mixed type of bleeding or otherwise with the concealed type of bleeding, you are unable to identify where is the mother's progress. So at that time the woman may go in for a shock. So you may lose the death, like you may lose the mother as well as the baby. Then we have sepsis. So in case if there is an abruptio placenta, maybe the bits of placenta are remaining inside the uterus, so the women may go in for sepsis. And then we have hemorrhage. So already the placenta has come out and you will not have adequate contractions, so the women may go in for bleeding, where you may land up with postpartum hemorrhage. And then we have rupture. So sometimes if it is not only the rupture of the placenta is taking place earlier, so in case if the labor is not proceeding in a normal way, or otherwise if you have started oxytocin and the stimulation of the uterus has taken place, and it may lead to hypostimulation of the uterus, which may cause rupture of the uterus. And then we have coagulation deficit, where the mother may go in for bleeding and PPH may end up. And sometimes it is anuria, maybe it is because of the hypovolemic shock, the woman is having an anuria. So these are the complications with the mother and fetus. Like already we said, like in case if you are not going to take care of the mother in the early phase, so definitely the baby is going in for hypoxia as well as distress, or otherwise it may also land up with intrauterine death. Okay, hope this class was useful, you understood the class. In case if any doubts you have, send me a message, so I will reply. Okay, so thank you, take care.